Well, if you missed it this morning, it was a groundbreaking morning on the CBS Early Show. Harry Smith became the first anchor to undergo a live colonoscopy. Harry was awake but sedated. Evening news anchor Katie Couric accompanied Harry as the doctor checked out his colon and reported the initial results.
The good news is Harry's colon is clean as a whistle, first of all. So you inserted the endoscope all the way to the end of the colon, and the real test or the real procedure is when you check through the camera on the way out of the colon, right, Mark?
Right. What we're doing now is we're looking at all the little folds here. You can see it on the monitor that as we pull back the scope and we put a little bit of air, and actually we're using carbon dioxide because it gets absorbed very quickly, we could see the intricacies of the colon, see this normal blood vessel.
That was amazing to watch. Katie lost her husband to colon cancer and has been an advocate of colon cancer awareness ever since. Colorectal cancer is the second leading cause of cancer death in the United States. For more on Harry's test and colon cancer, you can go to our website, cbs3.com. The story is right there on our homepage. And treating cancers can be a daunting task for the patients, their families, and even their doctors.
Oh, but advances in using genetic and molecular profiles of an individual's cancer cells have been making some treatments much more effective. This way, drug therapies and chemotherapies can be customized for the patient. I had the opportunity to talk to Dr. Alan Terzian, the chief of the Division of Medical Oncology at the Aria Health Cancer Center. He told me the first breakthrough using this approach came with leukemia, but it doesn't stop there.
This really started with a drug called Gleevec, which is a drug that specifically targets a mutation in CML, which is a form of leukemia. Patients who have CML have a specific molecular defect that Gleevec targets, and that drug has revolutionized the treatment of CML. It's gone from a almost universally fatal disease to one that's treated with a pill.
How effective do you find that kind of therapy with colon cancers and breast cancer specifically?
The newer treatments, in addition to chemotherapy, have been very effective. One technology that's been very interesting over the last 10 years is doing molecular profiles, for example, in breast cancer, where a newly diagnosed woman with breast cancer, you can take the cancer, send it to the lab, and they will analyze a 21-gene profile, which gets fit into a computer, and it spits out, based on what genes this particular cancer has, what your risk is of relapse. And it'll put patients in a low, medium, and high risk. And we know, for example, that patients with low-risk breast cancer get no benefit from chemo. The patients in high risk get a lot of benefit from chemo. And the group in the middle, we're not exactly sure, but the trials are ongoing to see how best to treat them. There's a similar test being done in colon cancer for early-stage colon cancer. And they don't have all the bugs worked out of this yet, but I think in the next couple of years we'll be using that to treat earlier stage colon cancers.
After so much research and after so much money being spent, we only can cure so many cancers. As an oncologist, though, do you find it frustrating that we don't have more cures?
Yes, but I think we're making progress. There are many, many, many different genetic defects in many different cancers, and we don't know what to do with all of these. But this is a very quickly evolving field of medicine, and I have no doubt over the next 5 years there are going to be more and more specific defects that are isolated for specific cancers, and there are going to be drugs developed to target those individual cancers. I think this is really the mode of the future.
Well, Dr. Terzian told me that colon cancer can affect people between the ages of 20 and 80.
Amazing.
If you have a history of it in your family, you do need to be screened.
Yeah, if you want more information on Aria's oncology program, you can call 1-877-808-ARIA, or you can check out ariahealth.org. We have all the information on our website, of course, cbs3.com/TalkPhilly. Well, we have a lot more ahead today on Talk Philly.
Well,